when it really comes down to a solution to a problem, the solution usually works out to be something very simple. The correct solution that actually solves the problem is usually a very simple concept or treatment or decision rather than something complicated. So doctors, for some reason, have lost their way in trying to make things complicated, maybe because they can make it complicated. Maybe they deserve a bigger fee, or maybe they're more important because they can make things complicated that the average person can't do. But the point is that complicated is not the right way to look at solving a problem, certainly a surgical medical problem. And in this case, especially the TMD problem, which has been a conundrum mystery for well over 70 years. Another good example in the area of TMD treatment is the doctors, small number, but growing, of doctors who, quote, specialize in TMD treatment and want to make it a very complicated system that they apply because, well, it makes it more important or keeps the competition away. I'm not sure. I really am not sure. But I see it. I can't get into their minds and decide what it is that drives them to want to make something complicated. But the simplicity of this, the simplicity of TMD is that if you damage a joint, in this case, this joint called the temporomandibular joint, if you damage a joint, it creates inflammation trying to heal. Inflammation is the body's response to damage. Inflammation is the body's attempt to heal itself. If it worked all the time, you wouldn't need doctors. And that's a fact. That is a fact. If inflammation was successful 100% of the time, you wouldn't need doctors. However, there is a growing number of TMD gurus, is what I call them, who apply smoke and mirrors, complicated smoke and mirrors, multiple levels of smoke and mirrors, machines, all kinds of different things, multiple different kinds of drugs, and make it as complicated as possible. But if you follow me along, all of the common denominator actually is inflammation in the temporomandibular joint. So if you can figure out a way to decrease inflammation in the joint that is simple, not complicated, then you are doing the right thing. And what I discovered after I discovered that the common denominator of TMD was inflammation, and that inflammation created directly each and every one of those symptoms I mentioned, once you understand that the inflammation is the common denominator, then it was pretty easy to figure out how best to get rid of inflammation other than nonsteroidals or other things that have been available for years and years. But the way you get rid of inflammation is to rest the area. When it comes to joints, the orthopedic surgeons know how to rest a joint. Unless if the damage is so severe, then you have to apply surgical correction of various kinds. But the easiest way, the most successful way to rest a joint is to unload the joint. In an elbow, it would be a sling. Yeah, for a hip, it would be a set of crutches. And for the temporomandibular joint, it would be a device that you put in your mouth that took the load off the jaw joints. 90% of the loads on the jaw joint are from the posterior teeth. So if you unload the posterior teeth, you're taking 90% of the loads off of the temporomandibular joint. At which point, when you do that long enough, according to a well worked out protocol, which is 24/7, wearing it full time, except when you eat for the first 2 months, and then nighttime only the rest of your life, that's pretty simple. You can talk with it in your mouth. You just can't chew with it in your mouth. Quite simple. So if you use this device appropriately, it's not hard to use. You unload the posterior teeth, unloading the temporomandibular joint. Inflammation goes down. Inflammation drives all the symptoms, and guess what happens? All the symptoms go down. They go away. You just have to be consistent and you have to follow the protocol. So a device, in this case, just like a set of crutches or a sling, is the simplest way to treat TMD, and less is better than complicated when treating the TMD.